So here's one example of reactive neuromuscular facilitation. I'm going to go through a couple of exercises. What you can see is I've got this band affixed in the door jamb. This is how you would show a patient how to do it at home. If you were in the clinic with someone, you may want to be holding the band yourself. You can gauge the amount of tension, the direction of the force. But the idea is to have a force pulling the leg inward here into this femoral adduction and internal rotation. And what the patient's job is to keep that positioning in neutral. So as we talk about hip, knee, and second toe, this is sort of giving them a cue to pull out, and depending on how much resistance and force is on this band, or you can even use something without elasticity or rope if you really want to make it hard, you're going to be getting a lot of input for these posterior lateral hip muscles to be working while the patient's performing a functional exercise. So I'll show you sort of a split squat and maybe a single leg RDL, but think of any of these single leg stance exercises that we've done for resistance. You can add this in along with some of the other cues that we're talking about and really refine and get to the details of why their technique and why their movement might be inefficient. So for this position here, I'm just going to do this kind of a split leg squat just so you can get an idea. But again, you can do this with step ups and lunges and whatever you want to do it with. So this is pulling me here. I'm going to cue the patient, okay, keep that alignment, the hip, the knee, and the second toe, we're all in kind of a straight line. And now from here, I'm going to sit down into that step. Again, I'm not letting them cave in here. They're fighting against that resistance. And all my cues are the same for what we discussed with the resistance. You know, I can mess with the knee moment, where they're planting the weight in their foot, and all those things are still there. All those parameters are still in place. I've just added this resistance here to get the posterior lateral hip muscles to work a little bit more. And you can try to practice this move on your own and feel the difference when you've got a good amount of tension here, what it feels like to do it without that and what it feels like to do it with what muscles are recruited. Where do you feel it working?